Amanda with Straightsmile Solutions, straightsmilesolutions.com. Let's talk about facial harmony and treatment planning, especially for concave faces. And I've done a lot of other content on this, and this is also covered in our Straightwire course. Definitely check it out, or you can work with us on a case, one-on-one. We do offer that, as little as just one case. So keep in mind when you're working on cases, I would love for you to get really proficient in E-line evaluation. Letter E, like Edgar, E-line, two different words. Letter E, line. Go into my YouTube channel if you haven't taken one of my courses and put in the keyword E-line. It's a total of 5 digits, E-line, okay? And watch all that content on diagnosing with E-line. Now, E-line is just a form essentially of a CEPH. I mean, a CEPH is an X-ray that we take of the profile. The E-line is just checking the profile on the patient's face or from a photo. So you don't have to have imaging in order to do E-line. You could just do it when the patient's sitting in the chair. It's a great way, before you even look in the mouth, the E-line is one of the first things I want to look at because I don't want my head to get biased. I want to see what I see, my snap judgment when I see the patient from the side. Concave profile, straight profile, convex profile. Do I like the profile? If I like the profile, like if I saw this patient and then I saw this patient's profile, I probably wouldn't like that profile. I would think, ooh, no matter what ortho I do, whatever I do, I need to make sure I do not retract that upper lip. It's going to look terrible with her profile. I would put that in. That's the first thing I do. If I saw this one, I would say, I love her profile. Whatever I do, I don't want to mess with the profile. I want to leave it exactly like that, okay? So that's what you do, at least for profile. And then the rest, check out my content on thirds. There's a video I posted not too long ago called Thirds that's measuring the vertical and looking at the patient from the frontal aspect as opposed to the side or the profile aspect. And these are how we can get great facial harmony just by looking at what we have. Of course, getting the CEPH gives you numbers, which is also something that helps, but you never treat to the numbers. You treat to the face, you treat to the function, you treat to the posture, you treat to what works for the patient. And if you just don't treat with numbers and you treat with function and how the patient is working and feeling and harmonizing, they're going to have a great outcome. And of course, get your patient's, opinion as well. All right. Hopefully that helped. Thanks.